Welcome to an overview of the first NLN Nurse Educator Competency, Facilitate Learning. This is Mary Partouche speaking. This narrated presentation draws on the NLN Certified Nurse Educator 2015 Candidate Handbook available at nln.org. The slide headings are consistent with the 17 areas listed on the test plan for Competency 1, Facilitate Learning. This competency has the most objectives related to it as consistent with the nurse educator role of teaching. The first objective related to Competency 1 pertains to implementing a variety of teaching strategies. You should use a variety of teaching approaches depending on the context, situation, or circumstances. For example, first-year students benefit from explanations about new concepts, and if learning a new skill with both psychomotor and cognitive aspects, the lab setting may be preferable to the classroom. The first-year student who is CPR certified will not need as much practice on some skills compared to a student without CPR certification. The lab setting can promote active learning and learner-centered instruction. Case studies and scenarios are examples of strategies to promote active learning in the classroom and with lab simulations. A student's learning style will influence learning, thus collectively the teaching methods should appeal to visual, auditory, kinesthetic, tactile, and auditory visual learners. One of my practicum students gave her undergraduate students a learning style inventory and discovered that the majority of students in her class were kinesthetic learners who benefited from hands-on activities. So in addition to a brief PowerPoint presentation, she added a case study and pairs of gloves to discuss sterile technique. The strategy should match the desired learning outcomes. For example, if your desired learning outcome is that the student will demonstrate effective communication technique, role-playing in the classroom or simulation lab can help to achieve this learning outcome, and role-playing is an active learning student-centered activity. Research has shown quality of instruction is more important than method of delivery. Students may be more satisfied with face-to-face teaching, though research and my own teaching experiences have shown introverted students will speak up more in the online setting. Effective online learning includes student-to-student and faculty-to-student interactions, technology use, and prompt feedback. Simulation experiences prior to clinical learning experiences allow students to practice and make mistakes in a safe environment. Faculty research shows that successful clinical students are prepared, communicate effectively, and learn showing progress and accepting feedback, and this is achieved through support of simulation. Most sources show that there are five main educational theories. Behaviorism, which is a behavior occurs in response to a stimulus. For example, learning the basics of cardiopulmonary resuscitation or other physical tasks that follow a sequence are based on responding to a stimulus. Cognitivism, the learning conditions influence how one acquires, thinks about, and retains information. Mental models or stereotypes contribute to learning. Constructivism, if you notice, the root word here is to construct, and learning builds on prior experiences to build new knowledge. Social learning is learning through observing others, and this can be considered a subset of constructivism. As the learner builds on past experiences, positive experiences can increase confidence, and negative experiences can make a situation more challenging for the learner. For example, role-playing, clinical experiences, and simulation. In humanism, education inspires development for a person to become self-actualized through caring and respect of faculty as role models. There is a good chapter in Billings and Halstead on educational theories, and this provides examples of various theories under the 5 commonly identified categories of learning theories. There is also more information in Appendix A of Caputi if you have access to that booklet. Educational theory supports a paradigm shift from teacher-centered to student-centered learning, although there are still some teacher-oriented classrooms in nursing education. Active learning should promote higher-order thinking at the upper levels of Bloom's taxonomy, including application, analysis, synthesis, and evaluation. Research has shown that active learning resulted from the instructional methods that are listed on this slide. The competency-based or mastery learning, where competencies are identified and learner achieves these, for example, in testing out on CPR or lab competencies. Problem-based learning, a problem is posed, such as through a case study, and the student learns from using a problem-solving approach, either individually or in groups. Team-based learning, teams work together in the classroom to solve problems. A good source for team-based learning is Michelson and Parmalee, who use a structured approach which requires pre-class readings, an individual quiz at the beginning, then a group quiz, and followed by discussion to solve problems. The research showed that low-scoring students may learn more from the team-based approach. The flipped classroom. In some ways, the flipped classroom has characteristics of team-based learning. In the flipped classroom, students come to class having read and completed any assignments in advance, such as a study guide or viewing a presentation. The class is then structured to a certain extent and uses active learning strategies such as unfolding case studies, questions, and the like. Billings and Halstead has more information about the flipped classroom. Using strategies to engage students. This includes use of a technology-rich environment. Simulations, especially high-fidelity simulations, engage students and can make learning fun. Even more important, students can practice safely prior to encountering a clinical situation. A web-enhanced course can allow hands-on handouts to be prepared with students and be used with individuals and group activities, games, wiki projects, social media, to name a few examples. Collaborative testing shows there has been research that shows students test better with collaborative testing, though they may not retain the information quite as long. TBL testing, team-based learning testing, has shown collaborative testing benefits most the lower scoring student. Response systems. In response systems, questions are put on a slide and the students respond to them. Case situations with multiple responses stimulate thinking. There can also be open-ended questions and the students can buzz in if they think they know the answer. This could be used individually or with students in pairs. Clickers, cell phones, and paper can all be used in those response systems. Effective teaching strategies take into consideration that the learner brings to the learning experience. One of my early teaching experiences included tutoring an international student who had difficulty passing NCLEX RN. In her country, women were subservient to men, and this was reflected in a response to test questions. Test questions that involved a nursing role that was an independent function was almost always answered incorrectly. In translating into English, she selected roles that were dependent and sometimes interdependent, as was fitting for the women in her country. Tutoring then took on a different perspective in which cultural considerations were discussed. Many schools require students to have taken a certified nursing assistant course prior to acceptance into the nursing program. Students then come with the basic skills and some of the medical terminology mastered. Other educational experiences and life experiences, such as a college degree in another field or having emergency medical technician experience, can advance the learner, and then teaching builds on prior experiences. A good example of what has become a standard in nursing education is the accelerated nursing programs for students with a prior college degree. There are differences across generations. For example, those digital natives who multitask and then must need support to help them prioritize. Other considerations in learners could include gender, as male students function in a field-dominated profession. Web resources are now available in many classrooms, including electronic classrooms. Video clips on websites can be accessed from the classroom to engage students and emphasize positive and negative life events to which words alone do not do justice. Learning management systems have made it easier to communicate with and share resources with students and teach entire courses online. Student journals can be submitted in electronic forms, making it easier for faculty to read and give feedback. Wikis, Twitter, blogs, and podcasting are technologies to support teaching strategies. For example, I have student groups use a wiki to prepare for a debate. Some free access materials are also available at Creative Commons and other open source websites. Information is readily accessible on the web, and thus an educator needs to be knowledgeable about the fair use guidelines and copyright and communicate these to students.